brain results, and it seemed that skin and joint activity were reduced. So this advanced to phase 3, and we'll hear about that maybe in another year or two. And to finish with JAK signal transduction inhibitors, we heard about the JAKs before. I like this cartoon because at the top you can see the various cytokines that are dependent upon the various JAKs in the column on the far left. And there have been a few different programs, the major one being with baricitinib. And these data were presented about a year ago and recently published. This study, this phase 2 study, had as a unique endpoint resolution of arthritis or rash. And it was a successful study, modest results, but successful nonetheless, and successful enough to advance to phase 3, which is underway right now. So you'll hear about the following. We talked about many of the ones in red, and coming out soon, you'll hear about the details of TULIP-1, which is the anifrolumab study, and TULIP-2, which was the second anifrolumab study. The anti-CD40 ligand we'll hopefully hear about at EULAR, obinutuzumab maybe over the next 6 or 7 months. And there's also a belimumab phase 3 lupus nephritis trial. So there's a lot of activity. Sometimes they say there's more clinical trial activity in lupus than there are patients. So I'm optimistic about the future. I think some of these will hit, and we will eventually have better outcomes. So I thank you for your attention, and if there's time, I'll answer questions, or we can handle them at the panel.
All right, well, thank you very much, Dr. Furie. We will have a lot of time at the panel, and there were some questions. Let me get you one, though, that got several people interested. You mentioned hydroxychloroquine levels. Should we